Well, hey, everybody, this is Robert, and welcome to the latest Outbreak News live stream. It's been a while, and it's been a minute, right? I think the last time was in October. But as you all know, life gets busy, and there's always something that gets in the way. But we're back today, and we're back at a very interesting time. There's a lot of wild news out there concerning infectious diseases. So I definitely want to encourage you to tune in and see what some of the latest numbers are, some of the different situations are. I had to leave a lot of stuff out because of time, but there's a lot of things going on right now. And I think I want to go ahead and start out with perhaps the most mysterious of all, and that is the situation with the acute hepatitis of unknown etiology in children. Uh, they're looking at children under the age of 16, but the bulk of them have been under the age of 5, and so it's been reasonably serious, and it's something that needs to be taken a look at. And there's going to take a lot of study to figure this out. There's no doubt about that. But let's go ahead and take a look at some numbers out of Europe. That's kind of, UK and Europe are kind of like the genesis of this stuff. We had, of course, the 9 cases in Alabama very early on, but this is where the bulk of it has been and continues to be. And what we see here is in the EU, as of May 12, there was 115 cases of acute hepatitis among children aged 16 and below. We see cases in Austria, Belgium, Cyprus, Denmark, France, Greece, Ireland, Italy, the Netherlands, Norway, Poland, Portugal, Spain, and Sweden. Of this 115, 6 required a liver transplant. And there was 1 fatality in the EU, and that was very recently in a child under the age of 12 from Ireland. Now, outside of the EU, the UK is seen by far the most cases. They just reported another 13 the other day, so they're up to 176 of children aged 10 and under. That's the number they're using. And 11 required liver transplants. Most of them are 5 years and younger. Then if you go outside of the EU and the UK, there's been another 200 odd cases from a bunch of countries all over the world: Argentina, Brazil, Canada, Indonesia, Israel, Japan, and here in the United States. There's been, so total, according to the European CDC, about almost 500 total cases as of this publication. 12 fatalities have been reported. We've seen 5 in the US, 5 in Indonesia, and 1 each in Palestine and in Ireland, as I just previously spoke about. All right, let's go ahead and take a look at some more data from that the EU or the ECDC has to offer. And excuse me if it takes me a little while going from slide to slide, but that's how it is. And here's their latest surveillance summary. And what we got here is some other information. Is out of the EU, the majority, 76% of cases are under the age of 5. Of the 143 cases with information, 22 or 15% were admitted to an ICU. Of the 98 cases for which this information was available, 6 have received a liver transplant, which we already talked about. Overall, 151 cases were tested for adenovirus by any specimen type. 90 were positive, so that's about 60%. 6 out of 10 were adenovirus positive, and they tested on a whole bunch of different samples. And let's go ahead and take a look at that real quick. So whole blood, stool, serum, and respiratory, and the predominant specimen source for positive adenovirus was whole blood. And then there was some PCR tests done for SARS-CoV-2, coronavirus 2, and I think about 12% were positive. So it says of the 56 cases with data on COVID-19 vaccination, 47 were unvaccinated. So that's what we got out of Europe. So again, this is a big deal, and especially for the youngins. It's the little kids that are getting hit with this, and there's still a lot of mystery that goes along with this. And while I'm going from slide to slide, I want to give you the opportunity to go ahead and comment. I'm on the Outbreak News TV YouTube page, and comment questions. If you want to come on the show, if you got some information about any of these topics and you'd like to share it with the audience, I'll gladly bring you on. Just remember, you got to keep it clean. Okay, let's go on to the next slide, and that's from here in the U.S. And this is from a CDC Health Alert network. And what we got here is they just put this out the other day, and it's primarily for physicians. What are the recommendations for testing and reporting? But in here, we get to see some of the numbers. And it says, as of May 5th, CDC and state partners are investigating 109 children with hepatitis of unknown origin across 25 states and territories. More than half of them have tested positive for adenovirus, with more than 90% hospitalization, 14% with liver transplants, and 5 fatalities. And they talk about the background. A cluster of pediatric cases of hepatitis without an apparent etiology was identified and reported to the CDC in November 2021. A possible association between pediatric hepatitis and adenovirus infection is currently under investigation after laboratory testing identified adenovirus infection in all 9 patients in this initial cluster. And this was I think this was the Alabama cluster that they're talking about here. The 5 specimens that could be typed were all adenovirus type 41. And that's interesting. And we're going to talk about that momentarily. So let's go ahead and move on to see the latest information out of the UK, where they've been easily hit the hardest so far. And let me go ahead and find that slide. All right. Okay, we got it up there. Let me go ahead and go to the latest update. Oh, wrong slide. Okay, it looks like I lost that slide, but they reported another 13 cases Thursday or Friday, bringing it up to 176. They've had a number of liver transplants, and the UK is really kind of the epicenter of this theory about adenovirus. They're the ones pushing that. Now, some other places are looking at COVID-19. I mean, they're both being looked at, but some are putting more emphasis on one over the other, and we'll look at that in a moment. Okay, and then there was the other day, there was a recent press conference with the World Health Organization concerning a whole bunch of different topics. And the acute hepatitis situation was one of them. And let's take a look at, as one of the questions were directed towards, let me get the name right, Dr. Philippa Easterbrook took the questions. And other than discussing the numbers, this is what she said. At present, the leading hypothesis remain those which involve adenovirus, but I think with also still an important consideration about the role of COVID-19 as well, either as a co-infection or as a past infection. Over the last week, more testing has gone on, I think confirming that still around 70% of the cases that have been tested are positive for adeno. This is in the blood primarily, and we talked about that already. Further typing of adeno confirms that those that have been tested have identified subtype 41 as the prevalent one. Over the last week, there's also been some more histological examination that's looking at the tissue samples, the liver samples, the biopsies, and examining under the microscope. None of these show any of the typical features you might expect with liver inflammation due to adenovirus, but we are awaiting further examination of the biopsies. These are all based on the UK samples. Again, more testing for COVID show that around 18% are PCR positive, and the big focus over the next week is really looking at serological testing for previous exposure infections with COVID. All right, so this is from Philippa Easterbrook with the World Health Organization. That's what she has to say about the possible causes of this acute hepatitis in these kids. Let's take a look at what this report out of the CBC up in Canada and what they had to say about these two theories. And it's pretty interesting. All right, let me make sure you can see it. All right, COVID. All right, so it says research suggests possible link to COVID, and they're talking about a recent American case study in the Journal of Pediatric Gastroenterology and Nutrition, which was analyzing a previously healthy 3-year-old girl who developed acute liver failure a few weeks after recovering from a mild COVID infection. They say the patient had liver biopsy findings and blood testing consistent with a type of autoimmune hepatitis, which may have been triggered by COVID infection, according to Dr. Anna Peters with the Cincinnati Children's Hospital Medical Center. Peters goes on to say that while it's impossible to prove that COVID directly caused the liver disease in this case, it is possible the virus triggered an abnormal immune response that then attacked the liver. She goes on to say, I think it's important for physicians to be aware that this is a rare condition that may happen during or after a COVID infection. It's important to check liver tests in patients who aren't improving as expected, she said. Parents shouldn't panic, but see their pediatrician or primary care doctor if the child is ill. Prompt diagnosis and provision of supportive care is key to recovery. And then it goes on and talk a little bit about the adenovirus. Let me get to it real quick. Adenovirus remains the leading theory in the UK, while other global research teams were ringing alarms about the potential links to COVID. International health organizations are taking time to investigate other variety of possible causes. And they talk about Dr. Easterbrook with the WHO. And her role at the World Health Organization is HIV, hepatitis, and STI program senior scientist. And she says that there's some refinements of the working hypotheses being put forward by the UK Health Security Agency. Quote, the leading hypothesis remain those which include adenovirus, but I think with an important consideration of the role of COVID as well. All right, and we talked about that already. Now, in Europe, about 70% have been positive for adenovirus and much less positive for COVID. The UK team is now pulling on multiple threads, including a normal adenovirus infection gone awry due to a lack of exposure to viruses during the pandemic. Interesting. Or an exceptionally large wave of infections causing a rare complication to present more frequently, or an unusual bodily response tied to a co-infection or a prior infection with SARS-CoV-2. So those are some of the things that are being looked at. What about the other tests, right? When you think of somebody who has hepatitis, viral hepatitis, you think of what? A, B, C, D, and F. Excuse me, A, B, C, D, and E, right? Those are the five different strains that we're all familiar with. And this information came from the UK Health Security Agency, I don't know, several weeks ago. And it says the clinical syndrome among identified cases is acute hepatitis. And again, liver inflammation with markedly elevated liver enzymes. Many cases reported gastrointestinal symptoms to include abdominal pain, diarrhea, and vomiting, preceding the presentation with a severe acute hepatitis. And the increased level of liver enzymes, the AST and the ALT, very, very high, and jaundice. Most did not have fever. The common viruses that cause acute viral hepatitis viruses A, B, C, D, and E, have not been detected in any of these cases. And also, they pretty much have been able to rule out any kind of links to travel or any foreign countries. And this was out of the UK. So again, like I said, this is an absolute mystery. What do you think? Is it linked to prior COVID infection? Is it adenovirus? Remember, adenovirus is primarily a respiratory virus, with the exception, right, of adenovirus 41, which is gastrointestinal. So a lot of interesting stuff going on there. I got a comment from David on YouTube, and he says all these symptoms and infection remind me of parasites. Well, in a way, certain parasites do affect the liver in pretty dramatic ways, but typically it takes a long time too. So, what do you think? Is it adenovirus? Is it COVID? Is it linked to COVID? I mean, they try to link COVID to a lot of stuff. Is it linked to COVID? Is it some combination? Is it something they just haven't discovered yet? Is this even considered an outbreak? 500 cases worldwide. I don't think there's a whole lot of linkage. There may be some cases that are epidemiologically linked, but it doesn't appear to be, I don't know, what you would consider a classical outbreak. Love to get your thoughts on this, and this is definitely a mystery. I'm super curious, where this is headed. Because there's just so much unknown. Fortunately, a lot of the experts, right, and we've all had our fill of experts the past couple of years. A lot of them are saying, I don't know. So there's a lot of work to be done, and best of luck to them trying to figure this out, and best of luck to these kids. Got another comment from David. Let's move on to, let's go ahead and see what David has to say. And David wanted to know, do you talk about the parasite world or parasite outbreaks much? No, not often. There's not a lot of outbreaks. However, I do have a lot of interviews and videos concerning a wide array of parasites. And I also, if you look down through the different parts of the channel, have an educational section which talks about parasites, a variety of parasites. So yeah, there's a lot of stuff on this channel concerning parasites, but I haven't done any live streams on parasites. So if that's what you're asking, David, no, I haven't done that. And he says, I'm new to this channel. Well, welcome, David. I appreciate you coming by. I don't do live streams very often. I like to do them more often. Time is just rough sometimes. And but here we are today on this fine Saturday afternoon. All right, let me see what I want to jump on next. Got this tidbit of news a couple days ago from the World Health Organization, and haven't heard much about this recently. So I thought this was kind of interesting. And let me make sure y'all can see it. All right. So the World Health Organization published on Thursday, there was a couple of cases of MERS coronavirus in Qatar. And let's go ahead and take a look at that. From March 22 to April 3, 2 laboratory confirmed cases of Middle East Respiratory Syndrome coronavirus, or MERS CoV, were reported to the World Health Organization. One of them ended up being a fatality. Both cases had frequent close contact with dromedary camels and the consumption of their raw milk in the 14 days prior to the onset of symptoms. And the World Health Organization or Qatar, to the World Health Organization, did some wonderful details on the actual cases, and I just want to go over these. The first case was a 50-year-old male working and living in a camel farm in Al Shania, Doha. On March 16th, the case presented to the emergency department at Hamad Medical Corporation in Doha with a history of productive cough for 1 week, high-grade fever, and shortness of breath. The patient was admitted to the medical ward on March 17th, and on March 18th, due to deterioration of the health status, was transferred to the ICU. Nasopharyngeal swabs were collected and tested positive for MERS coronavirus by reverse transcription polymerase chain reaction at the virology lab. The patient had no comorbidities and reported frequent close contact with dromedary camels and the consumption of their raw milk in 14 days prior to the onset of symptoms. No recent travel history was reported for the case or any of the case's contacts. The contacts that were checked out, 4 of them, all tested negative. Now, the second case didn't turn out quite as well. It was a much older man, 85-year-old man, a dromedary camel owner living in Doha. March 18th, he presented to the emergency department, same hospital, with a history of productive cough for 1 week, high-grade fever, and shortness of breath. He was admitted, and like the other patient, his clinical status deteriorated pretty rapidly. Nasopharyngeal swab was tested positive for MERS coronavirus by PCR. March 22, the patient was intubated and transferred to the ICU, where he died on April 14th. Now, other than the fact that this gentleman was 85 years old, he had comorbidities of diabetes mellitus, hypotension, and hypercholesterol. And now he did have some travel. The investigation showed that 14 days prior to admission to the hospital, the case had traveled with his camel to Saudi Arabia, where he visited other dromedary camel owners. He has a lot of contact with the camels. He was drinking camel milk. And let's see. All right. Well, and let me just go ahead and give you the total numbers. This is the coronavirus that's been forgotten, right? Since 2020. The MERS, we had the first SARS coronavirus starting in Asia, and then that spread, and they had about a 10% fatality rate. Then MERS came around in 2012. I think the first cases were in Jordan, but I could be wrong. But it's definitely in the locale of Saudi Arabia and the Arabian Peninsula. That's kind of the epicenter for this virus. And let's take a look at what I think their case fatality rate for MERS is right around 35%. Can you imagine it? 35%. There's been about 2,800 cases, and 1/3 of them have been fatalities. Now, as far as Qatar itself, while Saudi Arabia has by far the most cases, since 2012, it says Qatar has reported a total of 28 human cases and 7 deaths. So that's 25% of the ones there have passed away. So since we've been all COVID all the time for a long time now, I'm just going to go over briefly a little bit about MERS for those who may not be familiar with it or may have forgotten about it. It wouldn't be surprising for sure. Let me make sure you can see that. Okay, here we go. This is from the CDC and trying to keep it nice and simple. And it says Middle East Respiratory Syndrome, MERS, is an illness caused by a virus, more specifically a coronavirus, MERS COVID. And most MERS patients develop severe respiratory illness with symptoms of fever, cough, and shortness of breath. About 3 or 4 out of every 10 patients die. Health officials first reported the disease in Saudi Arabia in September 2012. But through retrospective investigations, they later identified the first known cases in Jordan in April 2012. The largest known outbreak outside of the Arabian Peninsula was in Korea, and that was in 2015, and there was well over 100 cases there. I remember that very distinctly. What I'm really surprised about it was almost 7 years ago. That's pretty amazing. I didn't expect that. Let's see. People that are at risk are recent travelers from the Arabian Peninsula. Right, we've had 2 cases in the U.S. I think they were in 2014, and they are both travelers from somewhere in the Arabian Peninsula. Close contact with an ill traveler, close contact with confirmed cases, healthcare personnel if you're not using PPE, and people with exposure to camels. That's definitely one of the big things that we see when we do get reports. And we haven't seen any reports out of Saudi Arabia in some time, and they've been kind of shaky with the reports. The reports are coming out not on the most timely basis, but we always do keep our eye out for that from Saudi Arabia. This is good. Here's a list of countries with lab confirmed cases. Those in the Arabian Peninsula or thereabout: Bahrain, Iran, Jordan, Kuwait, Lebanon, Oman, Qatar, Saudi Arabia, the UAE, and Yemen. Then countries outside the Arabian Peninsula with travel-associated MERS, and that's very important to emphasize that all these are travel-associated. Somehow they were in the Arabian Peninsula somewhere and brought it back to their home country or one of these other countries. So we see them in Algeria, Austria, China, Egypt, France, Germany, Greece, Italy, Malaysia, Netherlands, Philippines, Korea, Thailand, Tunisia, Turkey, UK, and here in the United States. Here we go. MERS in the US. May 2014, they had 2 unlinked imported cases, one in Indiana and another one right here in Florida. Let me go to the FAQs before I move on to the next topic and see if there's anything else I need to mention. The source of MERS likely came from an animal source in the Arabian Peninsula. Studies have shown direct contact with camels as a risk factor for human infection. The symptoms are primarily respiratory. We're talking about some diarrhea and nausea, vomiting also. Pre-existing conditions for people who have had MERS include diabetes, cancer, chronic lung disease, chronic heart disease, chronic kidney disease. And I encourage you, if you're interested, I did an interview with Dr. Mike Osterholm 4 or 5 years ago about MERS itself, and you can find that on this channel. So I would encourage you to check it out, see what Dr. Osterholm has to say. about MERS. All right, now to one of the more interesting stories. Now, North Korea. North Korea has been one of the few countries that has reported zero COVID cases throughout this pandemic for 2 years. Nothing. Now, granted, they locked down hard. They closed their borders, and of course, the information that you get out of there is often sketch, right? You need to question it, but nothing was reported out of there until just the other day, and the one of the state-run newspapers or websites, Rodung Simcom, I think it's called. They reported there was cases of Omicron, but they didn't get into a lot of specifics. Then the day after, the Pyongyang Times reported more cases too, and they got into a little bit more detail. But I went to go check them out today and see what they had. What's the latest on this? Because we were talking, hundreds of thousands of cases, kind of like all of a sudden since the end of April. So, and they have no immunity. I don't know what they have for vaccines right there. And anyway, but let's go ahead and take a look at this. This is from the, let me make sure I got this correct. The Pyongyang Times. All right. And there's Kim Jong-un. And it says, this is the latest. This is just out. The Political Bureau of the Central Committee of the Workers' Party of Korea convened a consultative meeting at the office building of the party's Central Committee on May 14th to overhaul the top emergency epidemic prevention system under operation. And remember, this is translated, so the syntax may not be perfect. Kim Jong-un guided the meeting. It was attended by a whole bunch of different bureaucrats. Present there were observers were officials of the state emergency epidemic prevention sector and leading officials of the Ministry of Public Health. And here we go. On May 13th, here's our latest numbers. Over 174,000 people so far developed fever. No, that's just on that one day. May 13th, 174,000 people developed fever. And that's kind of how they're describing COVID. They describe it as fever. 81,000 were fully recovered. 21 people died that day nationwide. Now, the number of persons who had contracted fever from late April to May 13th totals over 524,000 throughout the country. About half of them have fully recovered. At least the other half are under medical treatment, and 27 people died. So it did go, when I reported on this on the website outbreaknewstoday.com yesterday, they had 6 fatalities. So they had 21 more. That's 27 total fatalities just in the past recent days. The report referred to data on the spread of the disease in every region and unit and the characteristics of its progress, and notified that in most cases the loss of life was caused by mistakes like overdosing of drugs, being unaware of scientific medical treatment methods. Interesting. I don't see any problem with the syntax there. So anyway, so this is what we're seeing. Remember that this country shut their borders, and that couldn't have helped an already very, very fragile economy. So things can't be very good in the Hermit Kingdom right now. God bless these people, and I hope they get what they need, right? I know South Korea and some other places are offering to send vaccines. I'm not sure if Kim Jong-un has accepted them. But yeah, this is definitely a story to keep our eye on. And the one thing that I find interesting is state media is pushing this stuff out. So that I don't think there's anything other than state media in North Korea. So this is all approved by the government. So they got, in the past 2 weeks, 500,000 cases of one of the COVID strains or multiple strains. Not sure. Anyway, I thought that was interesting, and that's definitely a story that we'll be keeping track of on the website, outbreaknewstoday.com. And I encourage you to check that out if you've never been to the website. We feature just that news and information on infectious diseases and outbreaks, and we put up research studies. We break up the website by geographic area if you've never been there. So you have a section for news out of Europe, news out of Asia, news out of Africa. And just really enjoy what we're doing. It's a very niche website. And I encourage you to check it out. And let me go ahead and shoot that out there in case you'd like to go check out the website. And there's the link right there. Okay, bird flu. Let's go ahead and check out bird flu. That's the next thing on my agenda today. And let's go see what the USDA has got to say. All right, make sure you guys can see the map. All right. And yeah, this is a pretty heavy bird flu season, much more. And we're dealing with H5N1 avian influenza. You maybe have heard of that in the past. That's got like a case fatality rate, according to the World Health Organization, about 60% of the 800 odd cases that have been confirmed, primarily in Asia, some in Egypt and around that area. About 60% have passed away from this virus. I suspect this is a different strain of the virus, but definitely something we have to be keeping our eyes on. Right now, the USDA, Animal and Plant Health Inspection Service, they give us nice updates on how many states have been affected, and it's up to right. What is that? Two-thirds of the states have had at least one confirmed infected flock since this all started several months ago. And we'll go ahead and take a look. No flocks have been detected in most of the Southeast. And last time I reported on this, it was none of the West Coast had cases in flocks, but apparently Washington and Oregon has in the past week or so. But most of the West Coast and most of the Southeast have not seen any. And of course, Hawaii hasn't. Alaska did see one recently. We did report on that case. And that's on the flocks. And you can tell what states are being battered the most, right? And if we take a look at it, look at Iowa. Iowa's had 15 affected commercial flocks, 4 affected backyard flocks. 13 million birds have been affected by this outbreak. And that's about, out of all of the birds that were affected throughout this outbreak so far, I think that's over a third of all birds from Iowa have been affected. So it's been a huge problem in Iowa. All right. How about wild birds? Because, this is where these backyard flocks are getting it from, right? Is wild birds flying over and, doing their duty or whatever and causing this problem. So let's take a look at the map for the wild birds and see how bad we're doing there. All right. Make sure y'all can see them. There we go. And as far as wild birds, probably just a hair more states, probably between 35 and 40 states have had positive, highly pathogenic avian influenza detections in wild birds so far. Interestingly, that Florida has seen the most wild birds. No, North Dakota has 197 Florida has had 107 so far. Florida's had 107 wild birds and no backyard flocks. So, and this is the latest information as of as of Monday. Now, so far we know of at least one case of a human case of this virus that has gone from birds to people. And this is reported some time ago, but I want to go ahead and just rehash it real quick. And that was out in Colorado. This was the end of the month, last month. Colorado officials are monitoring and testing people exposed to poultry and wild birds infected with avian flu, also known as H5N1. Earlier this week, a test revealed the presence of the virus in a single nasal sample from a person who was working on a farm with infected poultry. Now, they did repeat testing and it was negative. But they say because the person was in close contact with infected poultry, the virus has been present in the person's nose without causing an infection. It was an adult male under 40, basically asymptomatic, only reporting fatigue. He was put on Tamiflu. The CDC continues to say that the risk to people is very, very low. Here's some more information about the person. This was on a commercial farm in Montrose County, Colorado. The person who was an inmate at a state correctional facility in Delta County was working with poultry as part of a pre-release employment program where participants have the opportunity to work for private employers and be paid a prevailing wage. The affected flock had been euthanized and disposed of under the appropriate guidance. And anyway, that's all the information on that. And I don't believe there's been any more cases. If I'm wrong, go ahead and please correct me. And I'd like to check that out. Now, the bird flu situation has caught the attention of people in Washington, D.C. And they're looking for some more money. And let me go ahead and get you this press release from the office of Senator Chuck Grassley of Iowa, who is obviously concerned, right? I mean, I just showed you the numbers from Iowa. They're kind of off the charts. But Grassley, Amy Klobuchar, so this is a bipartisan thing. They are looking for more funding to address this outbreak. Says highly pathogenic avian influenza has been detected in 32 states. This is obviously several days old, so it's not quite up to date. And it's killed over 36 million birds. Let me see. It's got to be something about Grassley. Yeah. The outbreak has impacted around 19 sites across Iowa, affecting 13 million birds, more than any other state. And that's exactly what I showed you moments ago. Anyway, so you got Republican and Democratic senators from North Carolina, Delaware, Pennsylvania, on and on and on. And let's take a look at what their letter had to say real quick. I don't want to get too much into politics, but this is always a time when, especially if their constituents are at some sort of risk. Clearly, Grassley is hearing it from his constituents since Iowa is being hit so hard. Let's see what the letter says. Dear Chairman Baldwin and Ranking House Member Hoven, as you prepare for the fiscal year 2023 Agriculture and Rural Development, FDA and related agencies appropriation, we request robust funding to address the ongoing highly pathogenic avian influenza outbreak. Let's see. Let's look at the actual dollar and cents. The president's budget for the APHIS. Make sure I got all these acronyms down. The Department of Agriculture's Animal and Plant Health Inspection Service Avian Health Program was $65 million for fiscal year 2023, which reflects a small increase from the enacted level of $63 million in fiscal year 2021 and 2022. Given the recent outbreak, the ongoing increase in confirmed bird flu cases and the likelihood of further spread, we urge the subcommittee to make funding for the APHIS Avian Health Program a high priority. These funds are critical to response measures. So it sounds like they want more than $65 million. So we'll see where that goes. And I don't want to make this a political thing, but I understand why Grassley's doing it. I understand why Klobuchar is doing it. She's in kind of a similar situation. She's a neighboring state, and do we? Is this the? What will they do with this extra money? I don't know. Will it be audited? I don't know. Is it necessary? Maybe. We'll keep an eye on that. Because I always like to keep an eye on, what our elected officials are doing and what they're spending, as most Americans have no clue where all this money is going. And I'm not saying that additional funding for bird flu surveillance and all that is not necessary. I just want to know more details. Okay, let me go ahead and take a look at, you've heard the old adage, right? That the world's a lot smaller now, right? We have air travel. We have, people going from here to there in a matter of hours. That diseases can spread from here to there in a matter of hours, and we're seeing 2 such cases this week in different types of serious and potentially lethal viruses. And let me go ahead and start out with the UK. And you may have heard this story already. It was initially reported on May 7th. Okay. All right. So monkeypox, right? It's a relative of smallpox. They reported a case on May 7th in England. And the individual did some recent travel to Nigeria, where it was believed he contracted it before he came back to the UK. Nigeria has no shortage of monkeypox. That is one of the things that they are dealing with, among a lot of other diseases. So this patient's receiving care at the Guy's and St. Thomas NHS Foundation Trust in London. Close contacts are being looked at, and they're looking at people that were sitting close by on the flight to the UK, and so far really nothing. So, and that's happened in the UK before, so it's not that surprising. Now, the thing that I found a little surprising today, and maybe it shouldn't be, but I found it to be a little surprising, was the UK Health Security Agency confirmed 2 more cases. It says 2 individuals have been diagnosed with monkeypox in London. And they say the cases live together in the same household. Now, here's the kicker. They are not linked to the previous confirmed case announced on May 7th. Where and how they acquired their infection remains under investigation. Right? That should be creating some question marks above a lot of people's heads, right? How did they get infected? They are currently being treated in different hospitals in London. One is being treated, and the other one is isolating and does not currently require hospital treatment. Excuse me. Dr. Colin Brown, Director of Clinical and Emerging Infections, says we have confirmed 2 new monkeypox cases in England. They are not linked to the May 7th case. While investigations remain ongoing to determine the source of the infection, it is important to emphasize it does not spread easily between people and requires close personal contact with an infected symptomatic person. And they go on to say, of course, the overall risk to the general public remains very low. We are contacting any potential close contacts. We're also working with the NHS to reach any healthcare contacts who have had close contact with the cases prior to the confirmation of their infection. So we got that going on in England. At least one we know is travel associated. We're not sure about those other two. And I'd definitely be keeping an eye out for that. And then the last story I want to go over, and there's so many I could have gone over. And there's, the story out of Thailand giving you a warning about the simian malaria that's seeing record numbers this year. And there's so many other good stories, but for time, it's going on an hour now, so I got to go ahead and shut this down. I wanted to go over one last story, and that's in the same vein as the last, and that's travel associated. An imported case of Lassa fever reported in South Africa. And this is a very interesting story. So a case of Lassa fever was diagnosed in a man in KwaZulu-Natal. I hope I said that properly. 2 days ago, the man had extensive travel history in Nigeria, right? Nigeria is like the epicenter for Lassa fever. Before returning to South Africa, he fell ill after entering South Africa, was hospitalized at the Peter Maritzburg Hospital. The diagnosis of Lassa fever was confirmed through laboratory testing. Sadly, the man succumbed to the infection. Currently, efforts are underway to trace and monitor all possible contacts. So far, as of May 13th, when this report came out, no secondary cases have been reported. Lassa fever, if you're not familiar with it, it's a viral infection that's endemic in West Africa. Nigeria, Guinea, Liberia, those countries. Then you see in some other countries too, like Mali, Benin, and other surrounding countries. There's about 300,000 cases and 5,000 fatalities recorded annually in these endemic countries. There's no vaccine for it. The natural host for Lassa fever in these endemic countries is a rodent called the multimate rat. They're persistently infected and shed the virus in their urine and feces. Humans come in contact with the virus through direct contact or inhalation of the virus in areas that are infested with the infected rats. For example, contact with contaminated materials, ingestion of contaminated food, or inhalation of air that has been contaminated with urine droplets. Person-to-person transmission of the virus does not occur readily, and the virus does not spread through casual contact. Person-to-person transmission is not common and is mostly associated with hospital settings. Cases of Lassa fever in travelers returning from endemic countries are reported from time to time. In 2007, a case of Lassa fever was diagnosed in South Africa. So 15 years ago was the last time. The case involved a Nigerian citizen with extensive travel history to rural parts of Nigeria before falling ill and received medical treatment in South Africa. And again, there was no secondary cases there either. So, these viruses, these diseases know no borders, and we always have to remember that. In some of these things, like MERS, right? Lassa fever, monkeypox, no vaccine. I mean, they've used the smallpox vaccine to assist with monkeypox, but there's no monkeypox vaccine. But anyway, that's the latest hot off the press type news this week. And these are all things we'll be keeping a close eye on. The hepatitis situation, that will be something I will be keeping a very close eye on. The situation in North Korea, fascinating, absolutely fascinating. Bird flu and this monkeypox situation with these 2 additional cases. So be sure to check out outbreaknewstoday.com for any updates. I'll be trying to do live streams more frequently. Try to do one about once a week. I may do more frequently with shorter ones instead of an hour, maybe 20 minutes or a half hour. And trying to line up some guests for some good interviews for the podcast, Outbreak News interviews. And I encourage you to check that out too on Spotify, Apple, and anywhere else that you find podcasts. So go ahead and check out Outbreak News interviews. All right. I'm glad you spent some time with me today. I hope you enjoyed the show. Make sure you like the video, comment below, share with your friends, and I'll see you next time on Outbreak News TV. See you later.